Dr. Jaffe, what are inducible proteins?
Inducible proteins are very important. The two primary inducible, which means they get elevated in stress and elevated when there is infection or inflammation or repair deficit. The two primary inducible proteins are ferritin and fibrinogen. Now, we think of ferritin mostly in terms of iron, but it is more than that. And we think of fibrinogen mostly in terms of blood clotting, but it does much more than that. And so anytime you see an elevation in ferritin, you should check the fibrinogen. And if both are elevated, then look for the underlying repair deficit, inflammation, or maldigestion, dysbiosis, or exposure to hormone disrupting chemicals and solvent residues and such. There are many inducible proteins, TNF, cytokines, interleukins. I had the privilege of being in Tom Waldman's lab when he said, we have discovered something new called interleukin, and we're going to call it interleukin 1. Turned out to be profoundly important. And I said, Tom, how many interleukins do you think there will be? And he said, well, a few. There are over 1,000 that have been identified today. And so these are the molecules that allow communion and communication to occur between and among cells. It turns out that good crowds out bad. If you have enough fiber and probiotics, if you have enough support for your stomach and for repair of your enterocytes that line the digestive tract, then these inducible proteins will come back down to their healthy level because they're a sign of the need for more repair or counteracting the stresses of high-tech living. So I'd like to introduce you to inducible proteins and to understand what lab results mean. If you see ferritin elevated, think about checking fibrinogen or TNF or interleukin 1, 6, 12. Today, most people have a degree of inflammation and repair deficit as marked by an increase in ferritin and fibrinogen, both. If one is elevated, that might be more specific for iron, or it might be more specific for coagulopathies like DIC. And then I would check the D-dimers as well as the total fibrinogen. So I'd like you to know about inducible proteins and how to understand them in biology.